So a closer look at data, I'll just quickly walk through the second dimension of it, which is data. When a model is built, you need to understand what data that it's built on. Okay. For example, is it completely independent and it's identically distributed, which we know, right? Because you don't want to apply a distribution on one population on the results of that on another population, because it's completely different distribution. So they're okay, that's fine. And there is a 2 more minutes. Okay, sorry. Okay, so and then there is a whole bunch of federated learning, that federated data sets that you can do, which I think is the need of the hour, but I'll skip that for a second. So this is another way of looking at data. I'll just skip through it and quickly go through one thing, right? So this is an example of where something we worked on, which is we're looking at the keratoconus, the progression of keratoconus. Here, the data is very uniform. In some sense, the machine itself is normalizing the data. So we get on the right-hand side. Obviously, a lot of you may recognize this, but some of you. So we are okay with data here, because we don't need to worry about, because it's normalized by the machine, whatever the race or ethnicity or anything is, right? Then we look at it on how it's spread on population. But if you look at another work that we have done, here is a set of either we're taking direct images. See the fundus on the right-hand side, and see the fundus for a Caucasian on the right-hand side there, on the left-hand side and the right-hand side. It's completely different. There's reddish hue. So any results that are done on that would not work here. It did not work here. We had to redo there's a whole bunch of algorithms that we do for whatever we're studying. Okay? Some of them worked, some of them did not work. So we had to redo it for the different thing. We can put everything together and do it, but it depends on the model. Is it noise for the model, or should we have different models? That's all a modeler would do. But the key point that I'm drawing it is, you need to understand the model, you need to understand the data that the model is working on. And okay, quickly I'll go. One plea, one more slide, right? One plea from the practitioner side. I'm a practitioner in some, right? So is in this room, there's this lot of data that comes through. Okay, you see patients in and out. You see a lot of so it will be a gold mine for both your organization and for the larger good, if you have a way of doing that. It's not easy. Putting data sets is not easy. That's a science itself. Imputation techniques, which involves again AI maybe, because you need to make sure the distributions are okay, all the things that I was talking about. A lot of things that come into it. And privacy, you need to have, how you protect. And finally, after the data sets are there, then we need to have the validation working with the physician. So a plea from the practitioner side of things is, my dream scenario would be a lot of interns are working here, creating these data sets, producing these data sets, some of it shared in a common repository. That is what the contribution to science we would do. And Telangana is trying to do this whole AI thing, right? This is the fundamental of that. This will change what we do. Okay. So finally, this key takeaways: AI isn't monolithic, like I've been saying. Understand the data, and finally, obviously, this will enable, with all the applications that you're going to hear today. If you understand those two, especially if you're young medical student, we need to have them take a course or a workshop or whatever it is to understand these kinds of things, because that's what they're going to move into 10 years from now, 15 years from now, at the peak of their careers. Okay, thank you very much.